The tumor on Emmanuel Zayer's face started as a pimple on the left side of his nose about 2 years ago, when the boy was reaching puberty. Within a few months, said Noel Zayers, Emmanuel's father, the pimple grew into a fleshy mass and kept growing to the size of a basketball. The tumor is benign and not cancerous but threatens to fracture the boy's neck and suffocate him. Emmanuel, 14, labors to breathe as the 10-pound tumor presses down on his trachea, and he's undernourished because it is difficult for him to eat and swallow, said Dr. Robert Marks, chief of oral and maxillofacial surgery for the University of Miami Health System at UHealth. It's life-threatening by its very weight, Marks said of the tumor on Friday, as Emmanuel and his parents held a news conference at Jackson Memorial Hospital. Marks and a team of surgeons will operate to remove the tumor from Emmanuel's face on January 12 at Jackson's Holtz Children's Hospital. If nothing is done, Marks said, it will cause a fracture of his neck. Emmanuel and his parents, Noel Zayers and Melvis Vizino, arrived in Miami from their native Villa Clara in central Cuba about 3 weeks ago on a medical visa. The family has been staying at the Ronald McDonald House near Jackson Memorial, where Melvis Vizino said the staff has made them feel welcome. The children always have activities there, she said, adding that Emmanuel likes to build Lego toys, solve puzzles and watch cartoons. Marks said he first heard of Emmanuel's case at a medical conference where a group of missionaries presented x-rays and photos of the boy. Nobody knew what it was, he said. But Marks knew, because he has operated on patients with large facial tumors in the past, including Marley Cassius, a Haitian woman who had a 16-pound tumor removed from her face at Jackson Memorial more than a decade ago. Emmanuel was born in Cuba with a rare disorder called polyostotic fibrous dysplasia, which causes his body to develop scar-like tissue instead of bone. The disorder often causes fractures and deformities of the arms, legs and skull. Noel Zayers said Emmanuel was diagnosed with the disorder at age 2, when the bone in his hips began to fragment, causing his left leg to deform as he grew. He said doctors in Cuba would not risk performing surgery on Emmanuel's facial tumor. I knocked on a lot of hospital doors, he said. I thank God that we're here and that this country and Jackson Memorial would welcome us. To see our son deforming and all we can do is watch, it's not easy. Emmanuel's family, including younger sister Elizabeth, 8, in Villa Clara where his parents are pastors in an evangelical Christian church called Pacto con Dios, a pact with God, Noel Zayers said. He said that an American missionary had met Emmanuel in Cuba and asked his parents for permission to help. Eventually, the missionaries presented Emmanuel's case before Marks, who said he and a team of surgeons have been planning the complex operation for about 2 weeks. It will take 4 surgeons about 12 hours to remove the tumor while preserving blood flow, tying vessels and then reconstructing Emmanuel's nose so he can breathe easily. The surgical team must be careful to remove the entire tumor so it does not return, Marks said. Afterward, Emmanuel will need more surgeries to reconstruct his cheek, jaw and other facial features, and to implant prosthetic teeth. Marks said doctors are volunteering their time and expertise. We're doing this because how can we not help this young man, he said on Friday. But benefactors are raising money to pay for Emmanuel's hospital stay and other costs, such as drugs and medical supplies needed for his recovery. Marks estimated the costs could be $200,000 or more. IKF Wonder Fund, a Jackson Health Foundation program that helps critically ill children from countries around the world, has taken Emmanuel's case and launched a fundraising website for his surgeries at jacksonhealthfoundation.org. Emmanuel. Marks said first thing Emmanuel will notice after doctors remove the tumor is that his vision will improve. The boy's eyes work fine, Marks said, but the tumor has blocked much of his vision. He'll also be able to breathe a whole lot better, Marks said. He'll be able to eat a whole lot better, Melvis Vizino said. Emmanuel's life changed quickly because of the tumor. He's in the 9th grade and remained in school until last year, when she withdrew him. Vizino said Emmanuel gets along well with his friends, and that he was very active before the tumor, though he needed crutches to walk. Emmanuel now uses a wheelchair. He likes socializing, Vizino said. He has always been very connected to his community. Her hope is that Emmanuel's life will return to normal after the surgeries. The things God is doing with Emmanuel are big, she said. We don't always understand them, but we're believers.